So I'm gonna do a scan of the room. It's my patient. Okay. All right, now I'm gonna walk in, introduce myself. Hi, my name is Juliana. I'll be your nurse today. I'm gonna be performing the head to toe assessment. And then I already have all my supplies. They're all like right here. And then I'm gonna perform hand hygiene, provide privacy, and then can I get your name and date of birth?
Melody, 5/31/2002.
And then can I see your wristband? All right, so it's verified. Now I'm gonna ask her a few questions. Do you have any allergies that I should know about?
No.
Anything you want to tell me about your overall health? Are you in any pain? And sorry, Miss Spicer, I'm thinking. Any cultural considerations I should know about?
Mm-mm.
Okay, perfect. And now I'm gonna inspect her skin. Her skin is even and intact. And it's appropriate for her race and ethnicity, the skin color. She maintains good eye contact. The speech is clear and appropriate to situation. No respiratory distress noted. And they look to be even and regular. Her body is symmetric and she's sitting in an upright position. Her body movements seem to be smooth. And she looks well hygiene, no odors. No mobility aids she uses. She can assist herself. And she's dressed appropriate to the season. And she looks appropriate for her age, height, and gender, and weight. Now I'm going to move on to assessing the skin in more detail, which is intact, even, and appropriate to race and ethnicity. Any complications about your skin that you want to let me know?
No.
Okay. No signs of lesions, scars, tattoos. The only thing I can see is she has 2 earlobe piercings bilaterally. Her body hair is evenly distributed. No signs of cyanosis, jaundice, or ecchymosis. Now I'm going to palpate the skin. The skin is warm, dry, and smooth, which is a normal finding. Now I'm going to look at your nails, which look flat, round, thick, and smooth, and firm, clean, and no signs of clubbing. And now I'm going to do the capillary refill, which is in less than 3 seconds, which is a normal finding. Now I'm going to move on to assessing the head and neck. Her head is normal cephalic, symmetric, and asymmetric. Now I'm going to palpate her head. And no lesions, non-tender. Her hair is brown, long, clean, and evenly distributed and smooth. No lice or dandruff. Now I'm gonna inspect her face, which is symmetric. Her eyes are equal bilaterally. And then her eyes and mouth her nose and mouth are midline. Now I'm gonna palpate her frontal and her maxillary. Non-tender. Now I'm gonna look at her neck, which is symmetric. No signs of swelling or inflammation. No lesions. Now I'm going to palpate the trachea, which is midline. Now I'm going to palpate for the cardiac pulses. We're at a +2 bilaterally. Now I'm going to palpate the lymph nodes. Now the preauricular, postauricular, occipital, jugular, digastric, superficial, submandibular, submental, posterior submental. And then the deep cervical chain. And then the supraclavicular. Which are all non-palpable and non-tender, which is a normal finding. Now I'd use the Snellen chart to check for vision level, QD. And the normal range is 20/20, which would indicate that cranial nerve 2 is intact. Now I'm going to move on to the eyes. Sorry, I'm thinking. So her eyes are, or do you have anything, do you wear contacts or glasses?
Yeah, I wear contacts.
Okay, so her vision's corrected. Her eyes are brown. They're equal and symmetric. Her sclera is white, and then, and the eyebrows and eyelashes are evenly distributed and symmetrical. And now I'm gonna look at her conjunctiva, which is pink and moist, which is a normal finding. Now I'm gonna test for perla. All right, now I'm gonna shine my light. Okay, ready? I'm gonna see if it constricts. I'm gonna do it twice to both eyes. All right. And then both of the eyes constrict, and her pupil size is a 3 mm. Sorry, I'm thinking. Now I'm going to see if her eyes are accommodating to light. So I'm going to move the pen light in the middle. And her pupils converge and accommodating to light. Now I'm going to check for the 6 cardinal fields of gaze. Ready? Follow. 1, 2, 3, 4, 5, 6. Okay. And she was able to perform that test properly. And they would be able to follow them properly. No stigmatness was noted. And then cranial nerves 3, 4, and 6 are intact. And now I'm going to move on to assessing her mouth, ears, and nose. So her mouth, oh yeah, do you have any complications like hear loss, hearing aches?
No.
Nose, mouth, or throat? Any
No.
complications? No
Mm-mm.
sore throat?
Mm-mm.
All right, and then I'm going to look at the lips, and they're pink and moist and hydrated and asymmetric. Can you swallow for me? Can you cough? Do you have a gag reflex?
Yeah.
Okay. Do that. The fact that she's able to do all that, that means that cranial 9 was intact. Now can you open your mouth and say ah?
Ah.
Her teeth are white. Very well hygiene, gums and no signs of inflammation. Pink and moist. She doesn't have any teeth missing, and she doesn't have any tonsils, so they're undetectable. Now can you do it again? Sorry. Right. Sorry. Her uvula and soft palate rose midline, so that means that they're intact. Let's stick out your tongue again, and then move it side to side. And the tongue is midline. She's able to move it side to side. And that would be cranial nerve 12, and that means that's intact. Now I'm going to move on to the ears. I'm going to start by, the ears are symmetric, no swelling, no drainage or lesions. Now I'm going to palpate, auricle, the tragus, and then the mastoid process, which are non-tender. Now I'm going to do the whisper test. Can you close one ear? Light, tight, dynamite.
Light, tight, dynamite.
Okay, now I'm gonna have you do the other ear. Light, tight, dynamite.
Light, tight, dynamite.
So since she was able to do that, that would be cranial nerves 8 would be intact. Now moving on to the nose. The nose is midline symmetric, no swelling or drainage. Now I'm gonna check the patency. Okay, so 1, yeah. And then other side. No occlusion was present, which is a normal finding. Now I'm gonna do the smell test. Let's do this, okay. Alright, close your eyes and tell me what you smell.
Hand sanitizer.
Okay, hand sanitizer, that was right. So the fact that you're able to smell, that means that cranial nerve 1 is intact. Now can you clench your jaw for me? Okay. Now I'm gonna test for the sharpened dull sensation to your face, arms, and legs. Alright, this is what sharp feels like, and this is what soft feels like. Alright, tell me.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Sharp.
So since she was able to do that, no TMJ was noted. Cranial 5 and was intact. Can you smile and frown for me? And then raise your eyebrows. And that would be cranial nerve 7 is intact because she was able to frown and smile. Now I'm gonna move on to the respiratory. Have you had any shortness of breath recently?
No.
Any complications with your lungs?
No.
Okay. All right, now I'm gonna look at her respiratory rate for 30 seconds, starting now. All right, so it was 16, which is a normal finding. Her chest expanded symmetrically and even and regular and in normal depth. Now I'm going to palpate the interior and the posterior. No tenderness felt. And now I'm going to, the chest expansion. You breathe in deeply. Okay, good. Alright, she was able to expand her chest, and it was symmetric and even. Now I'm going to take a listen. I'm listening to her posterior lung side. Posterior, 9 lung sounds. Take a deep breath in and out for each one. Okay, deep breath in and out. 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 And then one more time. That's the 9th one. Okay. And now and then the lung sounds were clear bilaterally with no signs of avitation sounds. Now I'm gonna auscultate her interior. in 5 areas bilaterally. Where can you see? Okay, take a deep breath in, deep breath out, deep breath in.
It's fine. Just like stand over. Huh?
Mm-hmm. Deep breath in, and out. Then I went into an S form. And her interior lung sounds were clear with no signs of avitation sounds. Avitation sounds, yeah, I think that's how you say it. Now I'm going to move on to the cardiovascular assessment. Any complications with your heart?
No.
Anything wrong with your heartbeat?
No.
Oh, okay. Now I'm going to inspect. Oh no, I'm going to listen to your cardiac pulses. What is it? Oh yeah. I'm going to listen with the bell of my stethoscope for any breathes. Okay. No bruits were noted or heard. Now I'm just going to palpate for your interior chest wall. No pulsations were noted, which is a normal finding. No tenderness was indicated. Now I'm going to palpate her upper and lower extremities for edema. Lower and upper extremities. Can you see your feet in the video? Kinda.
Yeah.
No edema present in the upper or lower extremities. Now I'm going to auscultate her heart sounds. Staring at the aortic, the pulmonic, Herb's point, tricuspid, and mitral, which is here. S1 and S2 were heard. No murmurs were heard. Now I'm going to check for your radial pulses in both arms, which are at a +2 bilaterally. Now her posterior tibial. Can she see your feet?
No.
Isn't it here? Yeah. These are at a +2 bilaterally. And now her dorsalis pedis.
Let's just do this one.
Your feet are cold.
I know. They're always cold.
Which are at a +2 bilaterally as well. So all of them are within normal range. Or normal findings. So I did all, okay. Alright, now I'm gonna move on to the download assessment. So I'm gonna have you lay down, I don't know. Okay. Okay. Have you had anything wrong with your bowel movements recently or urinary system?
No.
No UTIs?
No.
Okay.
Stand.
And your stomach is flat, round, and appropriate for race and ethnicity for color. Her body hair is evenly distributed. Her umbilicus is inverted and midline. No signs of scars or striae. No abnormal aortic pulsations. I'm going to listen to your bowel sounds in all 4 quadrants. Now I'm going to start at the right lower quadrant. And then the right upper. And then the left upper. And then the left lower. All All bowel sounds were heard and active. Wait, not have to do with the bell. Now I'm gonna use the bell with the aorta and listen. Then the renal. And then the iliac on both sides. And then the femoral on both sides. No brutes were noted. And if her bowel sounds weren't active, I would have listened to in each 4 quadrants for 3 minutes. And now I'm gonna do light palpations in the starting with the lower right quadrant. Tell me if you feel any pain. Which are non-tender in all 4 quadrants, which is a normal finding. Now we're gonna move on to the musculoskeletal. Get back in your chair. Okay. And now, have you had any history of broken bones, any muscle problems or
No.
weakness?
No.
Okay. And you're not in any pain?
No.
Okay. No history of falls?
No.
Okay. Now I'm gonna inspect her body symmetry is symmetric. She's sitting in an upright position. Her limbs are symmetric in both upper and lower, and they're equal bilaterally. And I'm gonna inspect her spine. I'm just gonna. Which is midline and straight. Her spine was non-tender. No inflammation or abnormalities found or felt. Now I'm going to palpate your limbs. And then your lower. It seemed like you have good muscle mass and tones. Now I'm going to assess your strength. Can you hold my hands and squeeze? Her strength is at a +5 bilaterally. Push against my hands. Her strength's at a +5 bilaterally. Push against my hands. Which is also a normal finding because it's at +5. Now your range of motion. Can you move your head up and down and neck side to side and then full circles? Or her head and neck are in full range of motion in her neck. Can you show your shoulders? And now can you do it against my resistance? Okay. Alright. She was able to resist against my hands against on her shoulder, which means cranial nerve 11 is intact. Now can you bend and extend your elbows? Her elbows are in full range of motion. Can you move your wrist? Her wrists are also at full range of motion. Can you flex and extend your knees for me? And another knee. And now her knees are in full range of motion too bilaterally. Now can you point your foot up and down in circles and around? And she has full range of motion in her ankles and feet and toes. And then you already did your toes up and down, right? And then that was also a normal finding. So that's also full range of motion bilaterally. And then can you clench your hands? She has full range of motion in her fingers too, bilaterally, which is also an indication of a normal finding. Now I'm gonna assess your gait, so can I have you stand up, take 3 steps forward, and then 3 steps forward. Maybe one more time. Okay. All right, and my patient's gait was steady, proper, and her coordination was well. And she kept her balance the whole time. And the body movements were symmetric. And it was even, a smooth walk, a smooth gait. I'm sorry, I'm thinking. Right now I'm going to move on to neurological. Can you tell me your name?
Melody.
Can you tell me where you're at?
My house.
Can you tell me what day it is?
Wednesday.
And tell me where you're here.
Because we're recording the head to toe assessment.
And since you were able to answer those correctly, that means that you're alert and orientated times 4 to person, place, and situation and event. Can you do your finger to your nose with me? Okay. Now your hand to your finger. Alright, now she was able to perform that task with no difficulties. Now can you do your heel to your shin like this? I don't know if you can see that. And since she was able to complete that, it's a normal finding. Now I'm going to have you do the Romberg test. I'll have you stand up. And then close your eyes. Hands at your side. And then stand for 20 seconds. Okay, you can sit back down. And my patient was able to maintain her balance and her posture for 20 seconds with her eyes closed, which is a normal finding, so she passed the Romberg test. Now we're gonna go to the reflexes. Let me grab my hammer. So I'm gonna start at the patella. So, okay. All right, and then her reflexes were, she was able to reflex in both of her patellas bilaterally. Now I'm gonna do it in the Achilles. Okay. And she was able to do it in her left and her right. So it was appropriate, she was able to reflex it bilaterally in both Achilles. I'm trying to think, did I miss anything? And all of the patella and the Achilles were able to extend bilaterally. Okay, now I'm gonna give her the call light, ask her if she needs anything else, lower the bed to the lowest level, provide privacy, and then is there anything else you need? Okay, I completed your head to toe assessment. Any questions for me? Okay, have a good day.